and welcome to a special International Women's Day edition of Ignite Health in partnership with Caribbean Surgery Inc. My name is Moheni Ramprasad, and today we are discussing polycystic ovarian syndrome, or PCOS as it's best known. Common but often misunderstood. It's a common but often misunderstood condition affecting many women across Guyana and the Caribbean. Joining me today is Dr. Allea Phoenix and Dr. Rehana Fareed.
Hello.
Hi, doctors. How are you guys today?
We're great. It was a really nice journey here. I'm excited about the conversation that we're going to be having today concerning this condition.
Likewise, I'm also excited, especially that it's my first time, doing this.
It's my first time too, so let's hope we have a really good conversation.
You're doing great so far.
Thank you. So, doctors, what is PCOS? For those persons who have never heard about it before or want some more information on it, what is PCOS?
Well, polycystic ovarian syndrome, or PCOS, it's a common condition that affects women of reproductive age. And oftentimes, it doesn't present in the same way. It can be attributed with hormone imbalance, irregular ovulation, and sometimes some of these women can have cysts-like growths or follicles in their ovaries. And ultimately, this just causes an overall uncomfortable experience for these women.
Okay. So how common is PCOS in Guyana and the Caribbean?
Well, firstly, like worldwide, it affects women in almost all of the countries. However, in Guyana and the Caribbean, there have been research to know that the rate or the incident may be a bit higher due to different factors, most notably genetic predisposition and our diet in general. And also it can be attributed to the rising cost of chronic diseases, especially diabetes.
So for somebody that's now going through this, what can cause PCOS?
That's a very good question. Well, the unfortunate thing is that we don't know what the exact cause is of PCOS. But what we do know, it's largely seen to have hormone imbalance involved. And basically what is noted is that a lot of these women, they have a predominance of androgens, which is like a male type hormone, typically testosterone. And then it just causes a series of manifestations such as insulin resistance and other patterns that are not very good to handle, I guess. Some families have a genetic component, so it can run in family, but it's hard to say because there are some limitations when it comes to finding out a genetic source, especially in the Caribbean and Guyana at large.
So what are some of the symptoms that somebody could, like for a young person now trying to figure out if they have PCOS or not, what are some of the symptoms they should look out for?
So some of the symptoms, I'll highlight the most common one. Initially, when a patient would first present, they would say they're having irregular periods or no period at all. Persons can have excess acne, a lot of body hair. This is due to the predominance of the male hormone, androgens, as Dr. Phoenix would have noted earlier. A lot of women also note weight gain, especially around the abdomen. Another common symptom that usually manifests a bit later would be when women try to get pregnant. So a lot of women would get married, they've been trying for a long time to get pregnant and it doesn't happen. So when they do that checkup, that's also when they would note that they have PCOS, right? So it's mostly diagnosed and affects women in the reproductive ages.
So for somebody like, say, somebody told them they have the symptoms of polycystic ovary symptoms. What does polycystic ovaries mean?
Right. So the thing is, there's this misconception is that, if you have the diagnosis of polycystic ovarian syndrome, that you do have follicles or these cysts in the ovaries. The crazy thing is that you can actually have this condition with the absence of these follicles. But in some cases, you can have instances where the ovaries have these very small, immature follicles that are seen, and they're termed cysts. They're not necessarily dangerous, but they predominantly take over the ovaries. And because of this, these women have these irregular cycles. They don't experience ovulations because the cysts kind of compete with the body and actually going through that process. So it doesn't necessarily need to be a case where the person has the polycystic presentations in the ovary, but we use this classification called the fancy word, Rotterdam classification, where you need two of those things that we spoke about before, the hormone imbalance or the abnormal hair growth or even the polycystic ovaries that could cause this
So
to develop.
is PCOS caused by a lifestyle, or I haven't been exercising too regularly, or is it something that I've been eating, or is it caused by a person's lifestyle?
No, lifestyle habits does not cause PCOS, but changes in your lifestyle can help improve the symptoms of PCOS. For example, decreasing your sugar intake and exercising can help with managing the symptoms of PCOS.
So when I was diagnosed with PCOS, one of the things that the doctor told me is that my insulin resistance, I have to monitor my insulin resistance. Why is monitoring your insulin resistance so important in PCOS?
Very good. Because with PCOS, the condition in itself, it kind of affects how well the body can respond to insulin, you know? So what I often tell persons is that, you know, if you do something over and over, you kind of get like a tolerance to it. Similarly, insulin resistance can develop because the body doesn't respond to insulin in the same way, and it causes the body to ultimately try to produce more insulin, thinking that will be the solution, but it doesn't work, and it kind of overstimulates the ovary to produce more male hormones, which ultimately worsens that person's symptoms of all the things that we spoke about already. So because of this, persons with PCOS, they're kind of at risk of type 2 diabetes, which is what is typically seen where we have insulin resistance.
So PCOS was mostly, there's a stigma that says PCOS is usually accommodated persons that are of a heavier weight, or that are overweight and stuff. Can persons like a very slim person get PCOS?
Yes, presentations can vary, and as Dr. Phoenix would have mentioned, the Rotterdam criteria can be used. So some persons may lack the typical clinical features of PCOS, but they would have other symptoms or clinical presentations. They may have the polycystic ovaries noted on ultrasound, and they may also show the biochemical, they might have the biochemical findings, they might have high insulin and the hormone imbalances. So once you have 2 out of those 3 criteria, you are diagnosed with PCOS. So weight gain, no, it does not specify that you have PCOS. You have to look at the additional
So how, if you
symptoms.
go to the doctor, how is PCOS diagnosed?
Right. So as Dr. Fareed mentioned, the Rotterdam criteria, you need 2 of any of those symptoms that we talked about, whether it be an irregular period, signs of high male hormone levels such as testosterone. You may, during your workup with your doctor, you might find that when they do an ultrasound, they see the polycystic ovaries. And they may also do other tests to exclude other conditions, because the symptoms that are seen with PCOS can be manifested in other conditions such as thyroid problems or problems related to hormones higher up, like prolactin, for example. Typically, the person needs to have 2 out of any of those symptoms that we spoke about in order to get a diagnosis of PCOS.
Okay, thank you. Is there a starting age where a person can start developing PCOS?
Usually, PCOS starts to develop in the teenage years. However, it is most commonly diagnosed in Guyana in women between the ages of 20 to 30 years old, this is when most persons would try to, start a family and would have difficulties. And that is when they would go to their doctor and do further investigations. But it starts as early as their teenage years.
Okay. Can PCOS affect a person's fertility?
Yes, it can. And unfortunately, as we said, a lot of times persons find out they have PCOS because they're at the point where they want to start a family and it's just not happening. They're doing all of the things that they think would allow them to become successful and they're not. And as we mentioned before, PCOS causes you to miss that ovulation period, which is when a woman is typically most fertile. And in PCOS, sometimes that doesn't happen. So the opportunity doesn't really present itself. So yes, a lot of women in the Caribbean and in Guyana, they're impacted by PCOS in the sense that it increases their risk of infertility. But of course, there are a lot of avenues available now that would help them become successful in
So
achieving
that brings
this.
me back to my next follow-up on my next question. Can a person who has been diagnosed with PCOS get pregnant?
Definitely, definitely. With adequate management of their symptoms, controlling the weight, managing your sugar intake, small lifestyle changes such as exercise, diet, um, the proper medications, many women are able to successfully conceive and start their own families.
So a person has, let's say for instance, a person has been diagnosed with PCOS. What are some of the treatments that are available in Guyana to help this person deal with PCOS?
That's a very good question. Well, the treatment, gratefully, is a number of different steps available. First, we can start with basically lifestyle modifications. We said all persons that have PCOS, they're not necessarily overweight, but it's commonly seen. So changing your diet and lifestyle practices in terms of including exercise, including a balanced diet. These things are what are employed for patients that are diagnosed with PCOS. Even more so, because they don't ovulate on some cases, then we can rely on birth control pills. And how they work, they kind of help to regulate the cycle. And by doing this, these persons can actually experience ovulation, or they can simply use the ovulation induction medications. And these are commonly used. What about for persons that have insulin resistance, which is commonly seen in persons with PCOS? In that case, then we can prescribe metformin, which is a common medication that is used to manage type 2 diabetes. So there are a lot of pharmacological avenues and non-pharmacological avenues that are available in a number of sectors, in the public or in the private sector.
Thank you. Is PCOS linked to diabetes?
Yes, that's a very good question. What we see because of the effects of PCOS, most notably causing the high levels of insulin, a lot of women are at a higher risk of developing type 2 diabetes. This is also very relevant in our setting here in Guyana because a lot of persons would have had a strong family history of diabetes as well.
My next question is PCOS hereditary?
Right, so yes, it can be considered hereditary. It's more so seen in your first degree relatives, so like a mother, your sister. So the closer the relation you have with that person that has PCOS, the greater the chance that you can actually develop that condition.
Does PCOS increases your chances of getting or your risk of getting cancer?
Unfortunately, it does increase the risk of developing certain types of cancer, most notably endometrial cancer. This is because there's absent or irregular periods. So the lining of the uterus, it doesn't get to shed regularly. So women are at an increased risk for that type of cancer.
So in PCOS, why is it so often that women or persons suffering from it develop facial hairs?
Right, so the facial hair development, it's because of those high androgen levels, typically testosterone. And if you're not familiar, testosterone is a hormone that is predominant in men. So you kind of get that male pattern here growing. You get a beard, you get a mustache, you get hair on your chest. And it's a hard experience, I'm certain. But all women don't necessarily experience this. But unfortunately, yes, those are things that they can come by.
Can having a help to, sorry, can a diet help with PCOS?
Most definitely, as we would have mentioned, lifestyle changes are one of the first steps in managing PCOS successfully, especially in the Caribbean and in Guyana. We love to consume a lot of roti and rice.
Yeah.
So definitely decreasing the intake of those, limiting all the sodas and the sweet drinks, swank, Marby, sodas, all of these things. Definitely increase your intake of all the fresh fruits and vegetables that we have available, okra, callaloo, and so on. We do love to eat a lot of fried food. There's a lot of KFC is very popular. Fish, fried fish. So definitely replace those fried foods with healthier options, steamed or grilled. Would definitely help in controlling that.
Is exercise important? How important is exercise?
Exercise is very important for a person that has PCOS. Everybody in general, everybody in the room here. I always recommend to patients that they should employ exercise. The recommendations from the WHO is 30 minutes a day for 5 days in a week, which translates to about 150 minutes weekly. So if you can't do the 30 minutes, you can split it up even. You could do 50 minutes every day and you go a little extra. So it works out for you. And it would help improve the insulin sensitivity as well.
So I think I need to push some more in the gym. Is PCOS the same as ovarian cyst?
No, this is actually a common misconception that I have personally encountered as a practicing physician. A lot of persons would just go for an ultrasound, and the doctor would note, oh, you have cysts on your ovaries, and they're thinking they have this syndrome. However, as we would have mentioned before, you need a criteria, right? And you need 3 of those to be diagnosed with PCOS. So having follicles or cysts present on the ovaries only does not automatically give you a diagnosis of PCOS. You'd have to look at the clinical picture and do additional lab tests to rule out other conditions as well and to rule out PCOS.
Can PCOS cause mood swings or mood problems? But as in Ghana, we say mood swings.
Yes. So PCOS is a condition that's tailored around a hormone imbalance, and your hormones oftentimes influence your mood. If you're in a bad mood, unfortunately, some persons always think if you're in a bad mood, you're on your period. But unfortunately, because of the imbalances related to PCOS, yes, it can increase your risk of depression and anxiety in women with this condition. And also because of the challenges they have with their body image, they may not be pleased with how they see themselves in the mirror or just how they feel overall. So that could impact the person's mood and increase their risk of depression.
Should teenagers be tested for PCOS?
Yes, teenagers should be tested for PCOS, especially if they have some of the symptoms that are typical of PCOS, such as very irregular period, especially if they would have been having their periods for 2 years, more than 2 years, and it's been irregular. Severe acne, if they have excess hair, they should be evaluated.
So one of the big questions that most persons, like myself, have: can PCOS be cured?
Difficult answer to give to most patients, but unfortunately PCOS cannot be cured, but it can be managed with all of the things that we spoke about. It is something that will not limit you from having all of the experiences of life. It's just that you'll have to make a little bit more effort to have a balanced life. So unfortunately, no, it doesn't have a cure.
Can PCOS cause weight gain, rapid weight gain?
So one of the most common clinical presentations of PCOS is weight gain. A lot of women noted that they gain weight rapidly. If you're already overweight, it could make losing the weight difficult. But most persons would note they have increased weight gain with PCOS due to the hormonal imbalance and the insulin resistance.
So one of the things that I was put on when I was diagnosed with PCOS was the birth control pills. What are the roles of the birth control pills?
Right. So the birth control pills, they function by regulating our hormones. So they have hormones in them in its makeup. So because of that, it can reduce your androgen levels, improve acne if you do have that, and protect the uterus overall. So yes, it does have a role, and it's very helpful.
How useful is metformin?
That's a very good question. A lot of persons would come and ask, why did I get prescribed metformin? A lot of people, that's only for persons with diabetes, but because high insulin is a clinical feature of PCOS, metformin actually helps to manage that. So by managing the high insulin that's circulating in your bodies, it can ultimately have an effect on the ovaries that causes ovulation, which in turn regularizes your period. So in short, metformin helps to decrease insulin resistance and regularizes your period.
So Dr. Phoenix, can PCOS affect the pregnancy?
Yes, it can. So, by having PCOS in your pregnancy, you might be at risk of gestational diabetes. Why? Because we spoke about insulin resistance already. It can also increase your risk of high blood pressure in pregnancy. With gestational diabetes, sometimes you might have the risk of having a larger baby, which can make delivery more difficult. And also, you would require close monitoring during your pregnancy. So, yes, it can complicate the whole process.
Can breastfeeding help with PCOS?
Breastfeeding it has been noted to improve your metabolism and it can reduce the future risk of developing diabetes.
How can women in rural Guyana access care?
So, here in Guyana, centrally and regionally, they can visit the regional hospitals, health centers. They can visit their general or primary care physician where they can be referred to gynecology clinics. And they can even use the community health workers for follow up, especially in those far reach locations. And if they know that they have symptoms, they can reach out for early screening of diabetes and high blood pressure. So it's very important that they seek out care in their neighboring community and wherever they think that they can have easy access.
What is the key message for women in the Caribbean that you would like to give to women in the Caribbean with PCOS, relating to PCOS?
For women in Guyana and the Caribbean, I would want to let them know that PCOS is very manageable and it's not a life sentence, especially with early diagnosis and implementing proper lifestyle changes and proper medical care. Women can lead a healthy, fertile, and fulfilling life.
Phoenix, you want to add anything to that?
Yes, I'd like to reiterate all that Dr. Fareed has said. Definitely, you could live your life to the fullest. You just need to seek care early, urgently, so that you could move on, living your best life.
Thank you, doctor, so much for being here today. I'm sure that the women like myself, where we've gathered so much information from you today that it could better guide us in how we cope with what we're dealing with PCOS. So thank you guys so much.
It's been a pleasure.
It's been a pleasure.
That's it for this special edition of Ignite Health. If you are experiencing irregular periods, acne, weight changes, or difficulty conceiving, speak with a qualified professional practitioner. Thanks to Dr. Allea Phoenix and Dr. Rehana Fareed for joining us today. My name is Ms. Ramprasad, and thank you for watching, and happy International Women's Day.